Hi, my name is Haley Matthews, and today I'm going to be talking about endometriosis and how oxidative stress and antioxidants may play a role in the formation and treatment of endometriosis. Endometriosis is a condition that occurs in women when cells that should be growing inside of the uterus are growing on the outside of the uterus, and it creates a lot of pain and discomfort for women. And one of the most common side effects that doctors are starting to notice is that infertility is also a lot higher among women with endometriosis. And there's currently no definite cause for endometriosis. There's things that they believe cause it, but there is no thing that they can say for sure. And in turn, there's also no treatments for it. So today I'm going to be presenting some research that can shed some light on a potential treatment for endometriosis. The first one is from a study that was done on 55 women. All 55 women had been diagnosed with endometriosis, but they were diagnosed with either minimal, mild, moderate, or severe. And all women got some fluid from their uterus taken, and it was tested for some oxidative stress factors and indicators. And it was found that in women with severe endometriosis, they had a lot of oxidative stress. And women that had just mild and moderate endometriosis had only a little bit of signs of oxidative stress. So it showed that endometriosis could possibly be sped up by oxidative stress, or that women that have more oxidative stress just develop endometriosis more. But it was the first study of many to show that there may be a link. The second study that I had looked at was with another 60 women that all had been diagnosed with and confirmed with endometriosis. They were split up into two groups, a control and an experiment group. In the experiment group, they got antioxidant supplements, and the control group just got a placebo fake pill. There was nothing in it. It was just a sugar pill, and they took the pill every single day for 8 weeks. And before the trial started and after, the fluid in their uterus was taken to look at oxidative stress factors. And by the end of the 8 weeks, it was found that inflammation had been reduced by up to 43% in the women that were in the experiment group and received the antioxidants. And there was very little change in the control group, that they couldn't even say that there really was any change in it. And then they were also asked at the end of it how they would rate their pain, because endometriosis is a very painful condition, and 37% of the women said that they were experiencing less pelvic pain since taking the antioxidant supplement. So this was another example that maybe there is a link between antioxidants, oxidative stress, and endometriosis, and maybe we can look into antioxidants as a treatment for women in the future. And the third study that I found was interesting because instead of looking at women, they did semen analysis on men who were going to the doctors because they were experiencing infertility. And through the semen analysis, they looked for the same oxidative factors that they were looking for in the women. And they found that a lot of men who were having difficulty with having kids, they had a lot of oxidative stress. So for this study, they got control and experiment group again, and the experiment group received antioxidant supplements while the control group didn't. And this went on for 3 months, and at the end of the 3 months, they found that the oxidative stress was lowered in the men that got the antioxidant supplement, and that they had improved chances of having a child. So I think this is really important because it could shed light on maybe there is something that we can start to give to these people that suffer with endometriosis. And it would definitely be a breakthrough discovery.